These stories, there are probably multiple stories. Some of the patients may come with the complex conditions. Some of them may be denied care in other facilities or by the other surgeons. And when they come for second or third opinion, you've got to be careful and to analyze things. But some of the patients still can be operated. And the way that patients recover after surgery is not infrequently unpredictable. Some of the cases are straightforward, but some of them are more complex. Some patients after surgery may be asleep on the ventilator for a few days, and you've got to carefully analyze and to see what is the driving force behind that. The story is multiple. Some operations take time. There are multiple parts of the operation that you need to do, and probably more so in heart surgery rather than in lung surgery. And you need to plan your surgery and make sure that you follow the steps and you don't forget anything. Sometimes you plan one operation. I was planning on doing the surgery on one of the patients with minimally invasive mitral valve surgery, but as the investigation was accomplished just before surgery and we did a CT scan on the patient, I realized that there is an aneurysm of the ascending aorta, and that was just prior to the operation, so the surgery had to be changed. It's not something that you can do minimally invasively, but you have to address now not only the mitral valve that was leaking really severely, but to replace this aorta with the graft. And the patient himself came with severe mitral regurgitation, with the lungs full of fluid. We call it pulmonary edema. His legs were swollen because the heart wasn't coping well with the amount of the backflow of the blood through the leaking valve, through mitral valve. And here it's important to do things yourself and certainly to work with your colleague cardiologist to get the patient better. So the patient his condition was optimized. He received the treatments that would help him to get rid of extra fluid. So there was no rush into operating on this patient, and the outcome could have been worse than it was. So the his condition was better. I had to go and to repair the mitral valve with successful repair and to replace the ascending aorta. Big operation, but was tailored for this specifically patient. He has recovered very well. And they're just one of the multiple stories, I must say.